Hey, it's Dr. Gabal again, and I'm here today to talk to you about hormone replacement, specifically bioidentical hormone replacement with Biote, which is what we use here in our office, the Biote pellets. And so hormone replacement has gotten a really bad reputation for women especially, but there's also a lot of bad information out there for both men and women. So I'm here today to set the record straight for you. Hormones are super important for all of us, men and women, and testosterone especially is very much in charge of so many things for us. Sex drive, muscle mass to fat ratio, sense of well-being, even weight loss, weight gain can be associated, with low testosterone. And brain fog is also something else that can be made better with testosterone replacement, both for men and women. And a little known fact is that women actually have higher testosterone levels than estrogen levels. They're just measured in different millimoles versus nanomoles. And so we actually have higher testosterone than estrogen floating in our blood before menopause. However, our testosterone levels are still much lower than they would be for a male whose testosterone levels are much higher. Men also have some estrogen in their blood, but we tend not to replace that. It's very, very low levels usually of estrogen in their blood. And as women, we need both estrogen and testosterone for all those things that I said earlier, as well as for bone health, heart health, and for mental function, mental clarity. And there's also studies to show that hormone replacement can help prevent dementia. So there's so many good reasons to have hormone replacement. When you look at some studies that have shown some risks with hormone replacement, especially those estrogen studies that were done in the early 2000s, first of all, they were terrible studies. They did women a terrible disservice because of the way that the data was presented and the way that it was analyzed. And when they looked at the data later and broke it down into smaller subgroups, they really saw that the risks of hormone replacement were so small and only for certain subgroups of patients compared to the general population. So if you smoke, you should not have estrogen replacement. Absolutely, because that's going to increase your risk for bad things. But truly everyone else, it's a very safe thing. And we need it in order to prevent these other bad effects, especially for sex drive and libido and sense of well-being. We find that it can be life-changing for our patients. So feel free to talk to us about this. It's very safe. The other point I wanted to make is that hormone replacement with synthetic hormones causes an inflammatory byproduct, a metabolite at the end, which causes inflammation. And we know that total body inflammation is bad for anything. It's bad for cancer causing, it's bad for heart attacks, it's bad for strokes. So we don't want inflammation. And so those studies were also done on the synthetic hormones that do not look like what our body produces exactly. And so when you get that pro-inflammatory component at the end, that's really what increases the risk for those bad things, those side effects. If we're using the bioidentical hormones that are plant-based and very safe, they look so much like what we produce endogenously, what we produce naturally. They sit in the receptor the same, they cause great effects, but the side effects are less because you do not get the inflammation at the end, which is really what causes those bad side effects. So it's safe, it's effective. I get it. My family gets it. It's very, very important for all of us to do this. Excellent for anti-aging and for all of the things that I said earlier. So talk to us about it. We're happy to help. Thank you.